Whether you are watching this for yourself or for someone you loved, a parent, a spouse, a grandparent, this video is for you. You've been told, or someone close to you has been told, that the knee is gone. That replacement is the only option. முழங்கால் போய்விட்டது என்று சொன்னார்கள். வேற வழி இல்லை என்று சொன்னார்கள். Today, before the decision is made, I am going to ask you to pause, not to delay care, but to make a better decision. Before you decide, not to delay, but to decide better. I am Dr. A.K. Venkatachalam, founder of the Madras Joint Rejuvenation Center in Chennai. I am a fellow of the Royal College of Surgeons, UK trained with 4 decades in orthopedics. I spent much of my career performing knee replacements, bilateral, revision, high flexion procedures. I have seen from the inside what knee replacement does for patients who truly need it, and I have seen what it does to patients who did not. I now practice exclusively joint preservation and biological treatments. And in this video, I want to give you the clarity that most patients and families never receive before that surgical consent form is signed. I see this almost every day in my clinic here in Chennai. A son or daughter walks in, Amma or Appa with their mother or father and says, "Doctor, their knees are gone. They cannot walk without pain. They cannot sleep. They don't want to be a burden. Should we just go ahead with the surgery?" I understand exactly why you feel that way. You want them to walk again, to be independent, to be free from pain. And when a surgeon says replacement, it feels like the final solution. And if you are the patient watching this yourself, you may be exhausted. You may be told your only option is surgery. வலி தாங்காது, தூக்கம் வராது, ஒரே வழிதான் இருக்கு என்று சொல்கிறார்கள். The pain is unbearable. Sleep is gone. Do you be told there is only one way forward? I am not here to dismiss that pain. I am here to tell you that there may be more than one path. There may be more than one path. That is what this video is about. What knee replacement actually is. Let me be honest about what a total knee replacement is. It is a major surgery. It removes the natural surfaces of the joint, the femur, the tibia, and usually the patella, and replaces them with metal and plastic components. It is irreversible. Once the bone is cut and the implant is placed, there is no going back. For patients who are true end-stage candidates, grade 4, bone on bone, metabolically stable, it is a well-established procedure that has given many people their lives back. I do not dispute that, but I do dispute this, that it is the only option, that it should always come first, that the timing of the decision does not matter. The middle path, PRASAD, everything used in PRASAD comes from your own body, your blood, your fat, your bone marrow. Nothing foreign, nothing synthetic, nothing from a donor. The entire treatment takes 4 to 5 hours. The patient walks in, the patient walks out. The same day.
Which is your operated leg?
This leg.
This leg. How does it feel on the right leg?
Feels fine.
Huh?
Feels fine.
Okay.
Don't feel any pain.
Okay.
Nothing. Just the bandage is holding it tight for now.
உங்கள் சொந்த ரத்தம், உங்கள் சொந்த கொழுப்பு, உங்கள் சொந்த எலும்பு மஜ்ஜை, வெளியிலிருந்து எதுவும் இல்லை, செயற்கையாக எதுவும் இல்லை. 3 layers, 1 sitting, your own body, your own knee, still yours. The metabolic triage, HbA1c. This measures long-term blood sugar control. Why does it matter for a knee? Because elevated blood sugar damages small blood vessels. சர்க்கரை அளவை கட்டுப்படுத்தாவிட்டால் உங்கள் சொந்த உயிரணுக்கள் சரியாக வேலை செய்யாது. Traffic light, green, amber, red. பச்சை விளக்கு, சரி, போலாம். சிகிச்சை தொடரலாம். மஞ்சள், முதலில் சரி செய்யணும். சிவப்பு, இன்னும் தயாராக வேண்டும். Who is a candidate? And age. Age alone does not disqualify a patient. We have treated patients in their 80s and in their 30s. வயது மட்டுமே காரணமாக நிராகரிக்க மாட்டோம். முழங்காலின் நிலை, உடலின் நிலை, நோயாளியின் குறிக்கோள் இவை மூன்றும் தான் முடிவு செய்யும். The grade of arthritis, the metabolic profile, and the patient's goal determine candidacy. The question to ask. So, before signing a consent form for surgery, whether you are the patient or the family member making this decision, ask one question. Are we choosing replacement because it is truly the only option or because we have not explored the alternatives? இதுவே ஒரு வழி என்பதால் தான் தேர்ந்தெடுக்கிறோமா இல்ல வேற வழிகளை இன்னும் பார்க்கவில்லை என்பதால் தேர்ந்தெடுக்கிறோமா? The best joint is the one you were born with. நீங்கள் பிறந்த போது இருந்த முழங்கால் அதுவே சிறந்த முழங்கால். Don't just replace, rejuvenate. I am Dr. A.K. Venkatachalam at the Madras Joint Rejuvenation Center, Chennai.